Welcome back. As we earlier said in our intro, that the Ministry of Health and Population in Egypt has announced that Egypt is the first in the world to be declared free of hepatitis C by the WHO, and this, of course, gives credit to the initiative 100 million lives, according to the directives of President Abdel Fattah Sisi, that was launched for almost more than 3 years, that to a great extent has reduced the rate of new infections. And with us live over the phone is Dr. Awad Eddin, former Minister of Health. Good morning, Dr. Eddin.
Good morning.
How are you doing, sir? Talk to us about that good piece of news that Egypt is finally free from hepatitis C, and what were the steps taken in order to reach to that level?
Thank you very much for your invitation, and definitely the massive detection of the viral infection and availability and affordability of the medications for all patients, millions of patients, which and the medications were, some of them were manufactured here in Egypt, makes the access to the patients and proper management and the treatment. It leads to our successful game to eradicate hepatitis C from Egypt.
Right. Before we had more than 2 million that were diagnosed and evaluated, and they were treated. So, of course, as we all know, that we could give credit to the different health campaigns that the Ministry of Health was keen to launch. And you said it was followed up properly. But also the awareness campaigns, the health awareness campaigns, is very important.
Awareness and detection, because many patients infected with hepatitis C, they diagnosed because they not thought that they are already infected by hepatitis C. So that the detection of the virus and treatment was very important. And before this era, there is no definite radical treatment for hepatitis C. So that the discovery of the drugs which is useful to treat the disease is a key factor, and the availability, as I told you, is a key factor for treatment of the problem.
Right. Dr. Eddin, we need to know, of course, thanks to God, that Egypt is finally moving to a whole new level of health status, but also we need to know the reasons to be infected by hepatitis C, and how long have Egypt been suffering from that particular disease?
For a very long time, there is no what we call hepatitis C. At first, there is hepatitis A and B. And then they discover a new virus, it's called non-A, non-B. And then it is defined as hepatitis C. And definitely, the main causes of infection of the disease is the unsafe injections, unsafe some medical interventions, and also the unsafe blood. But now, and also one of the main causes is the injections to treat schistosomiasis or bilharziosis. And they will discover oral treatment for schistosomiasis, so that they not use the injections. And now the blood is very safe. The infection control in the hospitals, the use of well-sterilized instruments during medical interventions and dental interventions makes the problem of cross-infection is less. But at the same time, already we have 70 million infected with hepatitis C. So that the treatment of the patients and the decline in the prevalence of infection is a key factor for proper management of the case.
Right. Dr. Eddin, of course, you are a former Minister of Health and a current consultant to the President for Health Affairs, and you are occupying a very important and critical post. talk to us about the challenges that could face a country that is overpopulated, not necessarily Egypt, but other countries who are overly populated, and what precautions could be taken. Thanks to God that we did not suffer from any other, from the past period when we suffered from pandemics just like every other country in the world, and now we are free of hepatitis C. Talk to us about the precautions to be taken, maintaining a good health, and stay away to be infected by serious disease.
I think the early detection of diseases and the early detection of the chronic illnesses like hypertension and diabetes, the objectives to detect any congenital problem or hereditary diseases are very important. Another factor, if you look how Egypt managed the situation during the COVID-19 pandemic, it was a very successful story. We can able with our capabilities, with the support of the president and the government and the presence of institutes and the manpower, which is very, very good performance during the pandemic. All of these factors are very important. And I think that we are now in the new era for the health sector in Egypt, which is a very good era to prevent, to detect, to treat, and to manage all the cases in our country.
So the keynotes are early detection and also the diagnosis and protection, of course. So,
Yes.
and there is also the health insurance, which is important. And
Yes.
to our knowledge that Egypt or the governorate have started in executing that particular plan, and they've started with Port Said and another government, and now the turn is going to come over to the rest of the governments that are awaiting.
Yes.
Talk to us about
Yes.
the importance.
We have a map for implementation of
Right.
health insurance. We started now in six governorates: Port Said, Ismailia, Suez, Lossor, Aswan, and South Sinai. So that, and I think in the new future, in the new years, we have many new governorates will be covered by the health insurance. But until we apply the health insurance, we have the old or the system for insurance, which covered about 58% of the population. But anybody who is not covered by the insurance, already he received the medications and the treatment and the intervention in many available governmental hospitals and university hospitals.
Doctor, it's very notable that the era that we're living now in Egypt is witnessing a boom on many fronts and spheres. And let us take, for example, the infrastructure and mega projects that is facilitating life for us. Also, it's obvious that we are on our way to achieve another boom in the health sphere, especially that we have overcome the dangers of hepatitis C, and we have effected very successful health campaigns, not only in Egypt, but around some other countries in Africa also. And we are prevailing our health insurance system around the governorates. And by the end of 2030, health insurance is going to be prevailing all over Egypt. So talk to us about the plans for the Ministry of Health and the plans to be able to upgrade the health file in Egypt.
Yes, because when you implement the health insurance in any government, all of the understructures and the hospitals and the facilities, primary care units, all of these, which already give the services to the patients, is re-innovated and it's put under, because as you know, in the health insurance, we have a special body to estimate the capabilities and the good performance and all of the factors to be successful in implementing the health services. And even if you ask the private sector or the clinics or the pharmacies or the laboratories to give services or to receive services from this private sector, all of these must be qualified before any implementation to give the services to the population.
Right. Dr. Taqi, some disease are meant to be chronic. They were born to be chronic with humans. And other diseases are related to awareness and also the hygiene. So how the Ministry of Health is managing the health file with the citizens in order to cause or effect the utmost prevention for both disease, the chronic and the ones who are acquired as a result of negligence, as a result of unawareness, as a result of hygiene. Talk to us about that.
As you mentioned, we have disease which is preventable, and some diseases are curable, but some diseases are preventable, curable, and some diseases are preventable, treatable, and curable. Other diseases are preventable, curable, and treatable, and non-curable. So that education and early detection, as I mentioned, are very important factors to control the disease. So, for example, now the infectious disease is better controlled because we have the system for awareness about the infectious disease, including tuberculosis, including poliomyelitis, which is eradicated from Egypt too, and also including hepatitis C and other infectious diseases. Other diseases needs the population to know, like hypertension, diabetes, because hypertension and diabetes are preventable, treatable, but chronic disease. So that if you achieve early detection of, for example, hypertension or diabetes, and give the patient proper treatment, you can avoid many complications. For example, most of the cases of chronic renal diseases or chronic renal failure are related to uncontrolled diabetes or hypertension. So that the system of prevention, education, follow-up, treatment are very important, tight system to prevent the major complications of disease.
It's very obvious that the modern plan for health maintenance for the coming future is prevention and education and awareness, of course. They're all relative to each other. When we talk about prevention and education, do we talk about nutritional education? Do we talk about the clinical education? What type of education and how it is supposed to be given to the citizens?
All of these factors are very important. And the sectors, or any health sectors, include preventive sector and the treatment sector. And during our conferences for the medical societies in Egypt, we have a good part of our system or our conferences to give education, not only for the patient, but also for our colleagues, the medical staff, including nurses, pharmacists, and physicians. So that it is a tight system, and every part of it are very important for the management of disease.
Right. Of course, that is very important, education and awareness. And also important is that noting that Egypt possesses a good bouquet of excellent calibers when it comes to MDs, medical doctors. And as we all know that the world, most renowned doctors around the world happen to be Egyptians. So talk to us about the calibers that we possess when it comes to the health field and the Ministry of Health, and how can we invest in our good calibers, the doctors, try to empower them and enforce them, or what type of service is supposed to be upgraded?
I think our medical schools are very good, with very good standard, and we have many medical schools, and we have many staffs for the medical schools. All of these are very important in training, education, practical training for our physicians, our nurses, our pharmacists, so that don't forget the important role of the university hospitals in different governorates, which gives education, higher education, training, and implementation of all of the new medical interventions which is developed all over the world, so that the integration between the health sector, as I told you, university hospitals, which is now present in all of the governorates, are very important, a very important tool for training of the physicians.
Right. Generally speaking, when we talk about developing with any country, the most difficult files are the health and the educational files. It's a little bit complicated when it comes to developing and renovating and upgrading those two files. So talking about successful experiences, we have experiences like India, we have experiences like Germany, we have experiences like England also. So on our ways to develop and upgrade our health file, what type of experience do you think is fit for Egypt to follow the footsteps?
You forget the Egyptian experiences.
Egyptian experience.
You mentioned other experiences,
right,
but you forget the very successful medical experiences in Egypt.
Of course,
we have medical schools for more than 100 years or 200
That's
years,
true.
and many medical schools and many of our professors, and we are trained either internationally here or internationally. As I told you, we implement all the successful interventions and the training, which now is not less than or identical with other countries. So that our experiences, which is our capabilities, are very good, and we have, as you know, very successful results of the management of our patients, millions of surgical interventions of cardiac problems, cancer management, and others. So that if you need very long time to mention the successful story of health sector in Egypt.
Right. The reason I'm saying that is that because every country is facing obstacles, and every country is facing challenges when it comes to difficult files like health or educational files and other files also. And that's why sometimes we stumble, we might have stumbled in the past or in the current time, but we try to overcome the obstacles. Talk to us about these obstacles and how to overcome them, and what are the most challenging obstacles that could meet a file like the health file.
I think if you know or you study the Egyptian experiences during the COVID-19 for the last 4 years,
True.
It was very successful. And definitely we have some obstacles during the management and during this period, very long period, it's not short, 4 years. We have many obstacles, but we have the resolutions for these obstacles. That's why our story in management of this problem, we have two parallel lines. One of them is management of COVID-19 cases. At the same time, we have the plan to manage all of the other medical problems and the other interventions at the same time. Yeah, for example, we have two and 1.4 million deliveries during this period every year. So that many of these deliveries was normal. Sometimes we have major interventions. So that all of these are very successful stories.
That's very much true. And Egypt have become among the most leading experiences when it comes to the leading experiences in overcoming the COVID. But also
COVID, hepatitis C, poliomyelitis, tuberculosis, and other problems.
Great. But also talking about the dangers, the future dangers that could be resulted from, topics or issues like the climate change, for example, and the different environmental challenges, and the natural disasters, and the disturbance in the biological balance and the ecosystem and all that. That would definitely result in creating new types of disease and evolving new types of pandemics, and even the interference of economic greed in nature. These are all reasons to create new types of disease, to change the map of disease according to the world that the world might face. Do you agree or no?
Definitely, we expect that. And that is why now all the world, including Egypt, they follow up the problem of the government to make resolution for any problem. Hello?
Hello?
So that we have follow-up of these problems, as you mentioned, and we have many expectations, and we have the map of any medical problem which can be resulted from environmental changes.
Right. Dr. Awad Eddin, former Minister of Health and current consultant to the President for Health Affairs. Thank you so much. It was our pleasure having you today in the Breakfast Show. Thank you so much, and you have a beautiful day. And we're going to go to a short break, and we'll come to continue the Breakfast Show, so stay with us.